Thank you so much, Lou. And I do have to tell you that Lou is doing an extraordinarily fine job for the people of this riding. He listens carefully, he understands what the challenges are, and he works tirelessly to find a solution. And that's one of the things I really admire about Lou. He really does represent and advocate for his community. He's doing a wonderful job. So I'm really happy to be here with Lou, happy to be here in this beautiful, beautiful hospital, and happy to be celebrating a wonderful change in healthcare in Ontario. So what we're celebrating today is that we have actually reversed the brain drain. There was a time, not very long ago, that more doctors were leaving Ontario than coming to Ontario. In some cases, dozens were leaving the province. Dozens more were leaving than arriving. But we have, through a number of initiatives, actually reversed that trend. And we're here to celebrate that. A recent report came out from CIHI that said in 2009, so the most recent information we have, 174 more physicians left other jurisdictions to come to Ontario than left. 174. That's more than the graduating class of many of our schools of medicine. So it is a true advantage to the people of Ontario. And the people here in Cobourg are benefiting from that trend as well. I had the real pleasure of meeting Dr. Hamid and little Luke, who is a product of Dr. Hamid's good work here. Dr. Hamid has come here. I think you arrived in 2007. You've delivered hundreds of babies, cared for hundreds of women, and this new little one I haven't yet had a chance to hug, but I will. And Dr. Hamid has enormously contributed to healthcare here in Cobourg. Dr. Moulet, who is in emergency department, he's in Emerge, another example of a physician who is from the United States, has family here, and because of the good work, the great work of Health Force Ontario, is now practicing medicine right here in Cobourg. He's full-time in the emergency department, and again, providing excellent care. When we came to office in 2003, we had some real serious challenges in our healthcare system. Our wait times were far, far too long. Our people could not get access to primary health care. We rolled up our sleeves, we went to work. We've now got 94% of Ontarians attached to primary health care. That's 1.2 million more Ontarians have access to primary care than when we took office. We've attacked those wait times. We're working very, very hard to bring those wait times down. Under the previous government, those wait times were not even measured. So now we measure them, we understand what the problem behind them is, and we're making those investments to bring those wait times down. So today really is a day to celebrate the physicians who have come to Ontario from far and wide to bring their expertise to benefit the people of Ontario. I'm delighted that Brad Sinclair is here. Brad heads up our Health Force Ontario. He has reason to be busting those buttons today. He's worked very hard to make Ontario an option for doctors from elsewhere. I think we have come a long way. It's a better place to practice medicine. The word is getting out that we've got room for physicians. We need physicians in certain specialties, and Brad and Amanda is here as well from Health Force Ontario, working to make that happen. So it really is a great day to celebrate. I want to acknowledge Foster Laux is here, the chair of the LIN, who has been part of the team of people working to make this happen. So to Dr. Moulet and Dr. Hamid, you are representing hundreds of physicians who have chosen to make Ontario home. And today's our day to say thank you to you and to celebrate the contribution that you're making to healthcare here in Ontario.
Thank you, John, and it's a pleasure to welcome the Minister to our hospital community, especially for take time from our very busy schedule to acknowledge two of our international physicians. If I may just take a minute or two to tell you a quick story, just to show how hard it is sometimes to recruit physicians. My wife and I were recently in Las Vegas for a bit of a holiday, and we decided to go to the David Copperfield show. We were there typically early, and we were sitting in a booth that took 4 more people. One of them turned out to be a physician from the United States who was an emerge doctor. So I was chatting with them, and he wasn't very happy with their system. And I said, gee, this is an opportunity to possibly recruit this guy. Well, unfortunately, David Copperfield showed up and started doing his act. So I was interrupted, and so he put on a very good show. Now an hour and a half goes by, and he's finished. I turn to this guy. Oh, no, he comes back out. He's going to do an encore. So he picks 13 people at random from the audience. Well, one of them is my physician. So he gets them up on stage, and they climb up on this raised platform. You can see underneath it, and he gives them all flashlights, and they put a screen around it. Lights go down. You can see the flashlights beaming around behind the screen. 30 seconds go by. The lights come up. The screen falls down. All 13 of them disappeared. And there went my opportunity. So it's pretty hard to succeed when you've got David Copperfield working against you. We are very pleased to have our 2 international physicians join our staff. They've been excellent contributors, Dr. Hamid, Dr. Muley, and I hope we will get more of them over time. I think Ontario does have a very good system. There's been some very positive changes to healthcare, and I think the public in particular is benefiting from that.
I guess my position here can ultimately be defined as a form of a gift. When I first decided to become a physician, it was my parents cried, okay, because it was like the ultimately, if you will, the American dream, immigrants coming over and working hard in order for their children to ultimately become something different, maybe better, and more stable than the life that they lived growing up. And so I took that. And luckily, school in Newfoundland, Memorial, gave me the opportunity to study medicine. And from there, ultimately, my roots were, my seeds, I should say, were kind of like placed in terms of healthcare here in Canada. And I went back to New York, and I trained in pediatrics and emergency medicine. My wife's a physician, and she always said, I think we should go back. Medicine is practiced a little bit differently. Different stresses to deal with, just a different level of care can ultimately be provided to patients. And the idea was always entertained, but yet never executed. And so finally we came to the point where, okay, it's time, we're growing a family, developing a family, and it's time to actually make a decision. And so we thought about it, and we researched it, spoke to a bunch of our friends and colleagues here that are practicing in Ontario. And they only had good things to say, and a lot of them actually did train in Newfoundland, or at least schooled in Newfoundland, trained in Ontario, and settled here. So here we are. We had some family that kind of drew us to the area. Okay, obviously for support that was necessary, especially with children. So I started experimenting with how can I practice emergency medicine, and ultimately, Health Force Ontario was able to give me significant direction how we can do this, and they introduced me to Mr. Byron and Dr. Broderick. And after talking to them, I got significant insight on what I want to do and where I want to be. My first day here, I was working a shift in December, okay, and I called radiology to discuss a particular study that needed to be done. And I spoke to Dr. Paravano, and he introduced himself as Joe, and he was very happy that I came on, and he heard about me and that I was joining as a full-time physician and so forth. And he said to me, you are very lucky because this place is a gem. That's what Joe said. And I was like, wow. I haven't met many physicians say that about an institution. I've been in a couple, I have some experience, within city hospitals and within private institutions. And I didn't really appreciate that until I kind of came here and learned, at least met the staff and learned how things work. It's very different for me, working with family physicians who ultimately are out there trying to provide a level of care that everyone needs. Triaging patients, assessing patients, they say, okay, we need to bring you into the hospital, discussing the cases with me, saying, okay, this is our situation, can you ultimately initiate the treatment process and then we'll take over. And so it was actually overwhelming, but very positive to see the level of compassion and actually the level of concern that they have for their patients. And so now here I am, and I'm working with the patients. So now I need to ultimately initiate a process of resuscitation, initiate a process of treatment, and develop a plan. And then the family doctors were there for me. Then the beauty of it is that I have other specialists here, from the anesthesiologists to the OBGYNs to the surgeons to the internists, slash intensivists that are also there to help me, and the radiologists that are also there to help me provide care to these patients. And what I found was there's this wonderful connection between the physicians here, which I never experienced anywhere else. So that's why I'm very happy to be a part of this team. It's ultimately family oriented in a sense, if you mind me using such an elementary yet passionate, way of defining it, where there's, a level of growth amongst everyone, and yet everyone's welcomed me. And so I only have good things to say. My experience here has been very positive, and I'm very happy that at this point in my career, I'm able to actually transition into this, or at least initiate the transition back in January. And so, what I've found is that because of Amanda and Giles over at Health Force Ontario introducing me to this team, I've been able to grow, within my career. Not only have I grown from an intellectual and academic perspective, but yes, I've also grown personally here because I finally belong to a team of physicians as opposed to just emergency department, which I never had that experience. My other hospitals, I was part of the emergency department, and that's it. Here, I'm part of a physician group, which we all work together, and it was actually very nice. I never experienced that, and I think that's the core of healthcare, especially here in Coburg, which I'm very happy to be here for that reason alone. So I have to thank you guys for giving me that opportunity. Again, I need to ultimately thank Amanda and Giles over at Health Force Ontario because they were unbelievably receptive and unbelievably diligent in terms of helping me find the place where I would fit, and they did a great job. So, all right. Anyway, thank you.
Minister Matthews, ladies and gentlemen, good morning. I will be very brief. I actually just want to really thank you for this opportunity, to thank the Government of Ontario for giving me this opportunity to come and work in Ontario, and I deeply appreciate the help I received from the government because I am an East Indian doctor, and I learned to say East Indian since I stayed in Saskatchewan So I finished my my graduate degree from India, and then I moved to the Middle East. So I've been traveling a lot. I worked in 2 Middle East countries, following which I went to Britain and I did my membership there, and I was recruited directly by Saskatchewan. So I came on a job to Saskatchewan, stayed there over 6 years. It was a wonderful experience for me to work there, but I really was looking for an opportunity to come and work in Ontario. So I applied for this registration through practice assessment, by which means I obtained the license to come and work here, and I feel that I'm very fortunate to have to get this opportunity to work in Northumberland Hospital. It's a very strong reputation for good reason. We have a wonderful obstetric unit, and I gain great joy from looking after the women of our community and of the surrounding regions, because, as I said, we have a really good reputation for our obstetric unit. And last but not least, I think I am working with one of the best administrations out of all the hospitals that I have worked in the past. And I want to also thank Dr. Green, my colleague, who has been here over 30 years, and he's contributed a lot to the women of our community. I'm the primary obstetrics person because he doesn't take over primary obstetrics, so we complement our practice very well, and I'm very happy here. So thank you again. Thank you very much.